Hey guys, it's Dr. Kavicki Miller from Sparrow Family Medicine. So I'm here to talk about RSV, or the respiratory syncytial virus. This is a virus that can cause cold-like symptoms, including things like runny nose, fever, and cough in most children and adults. It's a seasonal illness, which is why we're talking about it right now. We see it start in the fall and peak in the winter, and typically symptoms can last up to 2 weeks. For older kids and adults, in general, it's a mild cold-like illness and nothing to really be concerned about. But for newborns who haven't seen RSV before, or for older adults whose immune system might not be working as well as it once did, it can really make them very sick. That virus can get down into the lungs and inflame the small airways and cause something called bronchiolitis, which causes wheezing, shortness of breath, and severe cough. So it's a big driver of hospitalization and even death in these age ranges. So one study looked at pediatric hospitalizations in infants less than 1 year of age, and RSV was the number one cause of hospitalization. And when we look at older adults, it's an even bigger issue with up to 160,000 hospitalizations a year and 10,000 deaths a year. So typically all we can do for these patients is supportive care, right? Because it's a virus, so we can use things like oxygen, fluids, or mechanical ventilation. But the other thing that we can do is we can prevent you from getting it or prevent you from getting severe disease. And we can do that through a vaccine. So we have a new vaccine which is available for adults who are 60 and older, and that helps to prevent you from getting RSV and also prevent you from getting severe RSV that would result in something like hospitalization or death. And the cool news is that it looks like it's at least lasting 2 seasons, if not more. So this is recommended for anybody who's higher risk, including if you have a history of heart or lung disease or if you're immunocompromised. We're hoping soon to have a vaccine for women who are pregnant so that they can get the vaccine while pregnant and pass that immunity on to their infant while it's in the womb, so that when they are born, they're born with that immunity in place. But until then, we have a new shot, which is a monoclonal antibody shot. So this is a shot that essentially contains antibodies to RSV, and that offers protection for infants who are less than 8 months of age. So all infants less than 8 months of age who are born or entering their first RSV season are eligible to get this, and that will severely or significantly lower their risk of hospitalization or death from RSV. So it's really cool. We have a lot of new tools that have come out in the last year to help combat this. So what can the rest of us do, though, right, to prevent ourselves from getting RSV or passing it on to people that we love and care about? Well, it's spread through touch. So you want to make sure that you're washing your hands, that you're not touching your face, especially if you're sick, and not kissing people who might have cold symptoms. So I hope this was helpful. We're always happy to answer questions here at Sparrow.